Eyelids, what it costs. $4,000 to $7,000 or $8,000 depending on what you have done. And so here's your options. There's the upper eyelid, there's the lower eyelid, and there's the brow. I usually look at eyelids as one piece, like the eye band area. And some people come in and they have a low brow and they have a heavy eyelid. And they think, all I want is my upper eyelids done. The problem is that their brow is so low that if you just do their eyelids, that you'll be sewing their eyebrow almost down to their lid crease and it will look weird. And so in order to have enough space to make it look good, we sometimes propose a brow lift with little incisions up here to get the brow up. It gives us enough space now that we can trim the eyelid skin and it won't look like we pull the eyebrow down to the lid crease. And so when you look at eyelids, you look at brows, you look at upper lids, you look at lower lids. You also, with lower lids, you look at, is there looseness here or not? Is there a bag under the eye? Is there a hollow circle? Is the mid-face loose? And so there's several factors that go into the design of these operations. It's not just one operation of, say, doing the lower eyelids. If all it is a little puffiness under the eye and a little hollow and the tissue's not loose, we can do it from the inside without even cutting the skin. That's a simpler procedure and it's not as costly because it's a quicker, easier, less complicated procedure. However, if you do brow lift, upper eyelids, lower eyelids, mid-face lift with it, it's going to be more complicated, take longer, take more anesthesia and operating time, and it'll be more expensive. And so it just depends on your anatomy and what we decide to do. Eyelids are complicated and there are a lot of different choices and it depends on your anatomy. You should come in for a consultation and sit down with us, and what we do is we look at your anatomy with you and we design it with you. It'll depend on what you want to accomplish. One of the things that I think that makes a big difference is your philosophy of your surgeon. Sometimes patients come in and all they want to do is their eyes. Well, if they also have jowls and neck and you only treat their eyes, you're cutting half of the front yard or painting half of the house. And so the question is, will it look more natural if you do the whole face rather than half of it? Well, I think it will, but it's the patient's choice. But patients are afraid that they're going to do too much surgery and it's going to look operated, because if they are afraid that the more they do, the more obvious it's going to be. Well, actually it's the opposite. The more you do, the less obvious it is and the more natural it looks. The ones that look weird are the ones that half did it, either this half or this half. And the little brat in me sometimes says, why don't we just do this half? And nobody's ever taken me up on that though. But I think if philosophically, if you want it to look untouched and you want it to look natural, consider not doing, half of your face. Do it all. It looks more natural. Go ahead and hit the like button if you enjoyed this video, and subscribe to the Austin-Weston YouTube channel to stay up to date with the latest in cosmetic surgery. For more information on the Austin-Weston Center, visit our website at austin-weston.com or click the link in the description below.